In this video, I will go over different types of renal tubular acidosis which are associated with non-anionic gap metabolic acidosis. So type 1, which is also known as distal renal tubular acidosis, is due to the inability to secrete hydrogen in the distal tubule of the kidney, as a consequence of which the urine pH will keep on increasing more than 5.5. And then due to the increased excretion of the potassium as well as calcium in these patients present with hypokalemia, and then due to the elevated level of the calcium in the urine, these patients will also develop renal stones. The next condition is type 2, also known as proximal renal tubular acidosis, which is due to the defect in the reabsorption of the bicarbonate in the proximal tubules. And so initially there would be an elevated level of bicarbonate secretion in the urine, but then later on, since these patients will develop metabolic acidosis, they would increase reabsorption of bicarbonate, as a consequence of which the urine pH will drop below 5.5. So just note that these patients are unable to absorb bicarbonate in the proximal renal tubules. And then since there is an elevated secretion of the potassium, they will also present with hypokalemia. They also present with hypophosphatemia, as well as decreased levels of calcitriol, which is the 1,25-dihydroxy vitamin D. So due to these reasons, these patients have decreased absorption of calcium, and thus they would develop osteomalacia as well as rickets. And then type 4 renal tubular acidosis is from hypoaldosteronism or from decreased response to the aldosterone. And so therefore, since aldosterone is working on the principal cells to absorb sodium in exchange for potassium, since potassium can no longer be secreted inside the renal tubules, these patients will present with hyperkalemia. And then hyperkalemia interferes with the production of the ammonia, and it also competes with the secretion of ammonia inside the urine, and thus these patients will have decreased urine pH. So the memory aid that I've provided you here is a triangle. From the top, you can only fit in H+, a little lower, the letter can be a little longer, HCO3, and finally you can have aldosterone fit inside the triangle. So H+ is associated with type 1, HCO3 is associated with type 2, and then aldosterone is associated with type 4 renal tubular acidosis. And that concludes our discussion.